Welcome. Thanks so much for joining us this afternoon. My name is Rachel Schoening, certified health coach, and I have my counterpart here, Noah Ingalls, certified personal trainer and a licensed mental health counselor. And today we're going to be discussing Stronger Heart, Healthier You, right? So the power of movement. So we're excited to review this material with you today, but before we jump in, let's review some of our housekeeping items. So first off, all attendees are going to be in listen-only mode for the duration of this webinar. Please submit your questions or your comments in the chat box that's located in the GoToWebinar control panel, which is located in the top right-hand side of your webinar screen. Our team will be monitoring those questions and answering them along the way. So again, please ask your questions. And finally, all presentation slides and resources can be accessed from the GoToWebinar panel, which is under the handouts section. All right, so agenda. What are we going to be reviewing today? So we will be reviewing and explaining the relationship between physical activity and cardiovascular health, identifying key cardiovascular benefits of regular exercise, differentiating between aerobic, resistance, and flexibility training and their roles in our cardiovascular wellness, and we'll be identifying some safe ways that you can increase daily physical activity. So with that, let's jump in, and the first thing that I always like to ask is, so why does heart health really matter? Well, your heart is what provides all of our body's organs with the oxygenated blood that they need to function properly. So a strong heart helps to lower the risk of heart disease, high blood pressure, diabetes complications, kidney disease, and much more, but also it helps to support your longevity and your quality of life. If you think about it, I mean, your heart is pumping a lot, right? It never really gets a break and it never stops. So it is very important that we take good care of ourselves and our heart so we can, again, have a great quality of life. So how exactly does the heart work? Well, if you take a look at this figure that we have here, this image, you can see that the heart is made up of 4 chambers. You've got the 2 upper chambers called both the right and the left atrium, and then the 2 lower chambers, which are called the left and the right ventricle. So the chambers are separated in the middle by a wall called the septum. That is very important. And blood is pumped through these chambers, aided by a bunch of heart valves, right, or 4 heart valves that work very precisely to make sure that blood is flowing only in one direction. So it's amazing when you take a look at the heart, and we'll kind of dive in a little bit deeper here, all of the pieces that have to be working in order to get oxygenated blood to our body and all of the organs. All right, so how exactly does the heart circulate blood from our body to our heart? Well, what you can see here in these images is we've got the blue blood, or that dark blue blood. This is low in oxygen blood. And what happens is that blood flows back from our heart after circulating through our body and returns to the heart through veins and enters the right atrium. From here, this chamber empties the blood through the tricuspid valve and enters into the right ventricle. After it's entered into the right ventricle, it has this ventricle actually pumps the blood through the pulmonary valve into the pulmonary artery, which takes the blood to the lungs, which is where all of that oxygenation happens. So, in summary here, we see that the low oxygenated blood from the body is pumped into the right atrium, into the right ventricle, then pumped out into the pulmonary artery, into the lungs, again, where it's going to get all of that oxygen. After it has all been oxygenated by the lungs, it has now turned that bright red color that you see in the image here. From here, it returns to the heart through the pulmonary veins to the left atrium this time, and then it passes through the mitral valve and enters into the left ventricle. From here, the left ventricle is what pumps that red oxygenated blood through the aortic valve and into the aorta and to basically the body's general circulation. So that is essentially how blood in our body is oxygenated through a heartbeat, right? So it's actually pretty amazing what our heart does and the specific way that it needs to work in order to provide our body with that oxygenated blood that we need to survive. So what does exercise do for your heart, specifically blood pressure? Well, we know that it helps to strengthen the heart muscles. So this, if you think about the Olympic athletes, right? They are very fit and strong individuals. Your heart itself is a muscle. So the rigorous exercise and activity that they are doing allows their body and their heart to become stronger and actually pump blood more efficiently. So that's why oftentimes you see those athletes have a lower heart rate than maybe someone who is more sedentary. So again, we see that with exercise, our heart pumps more efficiently, and again, more blood flow is makes it to muscles, and just a lot quicker, right, with less heartbeats. So the next piece of it is exercise helps to reduce our stress hormones, right? Stress hormones we know are an extra burden on the heart, so moving our body can assist with that. And then it also helps to just slow our heart rate and reduce blood pressure in general. So overall, exercise is really beneficial for keeping that blood pressure number in check, or maybe even helping to stabilize or lower that number, if you are someone who struggles with high blood pressure. So what does exercise do specifically for your cholesterol? So exercise actually increases your HDL. This is your good cholesterol. So anything that you do that gets your heart pumping, gets you sweating, that is going to help, again, produce that HDL, which helps to remove excess cholesterol and or your bad cholesterol from the bloodstream and takes it to your liver for disposal. So the result here is that we may see that our heart disease risk is lowered. Exercise also helps to lower our triglycerides, or those bad cholesterol numbers. So over time, we see less plaque buildup in our arteries. And finally, we see just overall improved blood vessel health. So the result is that reduced inflammation in our arteries, and the fact that they're more resistant to plaque buildup. And what about blood sugar? So exercise helps to lower our blood glucose levels. A lot of doctors, providers, that's probably one of the first things that they're going to mention if you are struggling with blood sugar, is just how much are you moving your body. It is something that is studied, it is known, moving our body helps to lower those numbers and keep them more steady. So one other thing that it helps to do is it helps to boost your body's sensitivity to insulin. So of course we encourage you to incorporate both aerobic and resistance exercise, which we'll talk on here in a little bit. But of course, we encourage you to reduce prolonged periods of sitting, laying down, just that being sedentary, correct? So for people with diabetes, the best time to exercise is usually the 1 to 3 hour mark after eating, when blood sugar is likely the highest. That's going to be, it's going to be important in general for almost anyone. The best time to exercise or move your body is after you eat. But of course, if you are diabetic, please make sure that you are working with your provider and talking to them about the safety of the exercise that you are doing, and making sure that you are moving in the best way possible for you, and keeping yourself safe, because it is important with diabetes to make sure that you are monitoring those blood sugar numbers, especially during exercise. And finally, what does exercise do for your heart, specifically when it comes to inflammation? So physical activity, we know, lowers certain levels of certain inflammatory markers like your C-reactive protein and your cytokines. So again, those are inflammatory markers. You may have heard them when you're at the doctor's office. Anything that we can do to help lower those in the body, we're going to see a benefit for. So when you exercise, your muscles also release what's called myokines, and these are natural anti-inflammatory substances. So basically something that we want to have in our blood, again, to help us just feel our best and reduce those inflammatory substances. And finally, we know that exercise can help lower stress and cortisol, which are known sources of inflammation in our body. So Overall, we know that exercise can really help to regulate our nervous system and reduce those inflammatory markers. So with that, I'm going to hand it over to Noah, and he's going to talk a little bit on the importance of exercise and how we can incorporate that into our everyday life.
Yeah, thank you so much, Rachel, for sharing all that great information about the heart, how it works, and why it's important. So, like Rachel highlighted, movement is one of the most important factors when it comes to heart health. So, exercise supports not only the physical function of the heart, but also your things like energy levels, stress management, sleep quality, and overall quality of life. So, that said, I also understand that exercise, workout planning can feel very overwhelming as a personal trainer. I see this all the time. There's so much information out there, different programs, trends, and different rules. So it's really hard to know where to even start with exercise. So my goal, hopefully today, is to simplify that for you. I want to provide some education that helps you understand what matters when it comes to movement and heart health. So we'll be talking about the three main types of exercise that are important for your heart and overall health. From there, we'll discuss the importance of recovery and why rest is one of the most overlooked parts of exercise success. Then we'll go over some general exercise guidelines so you have a better sense of maybe what's recommended and what's realistic for you. Finally, I'll leave you with some practical tips you can use to structure a workout in a way that fits your life. This isn't about perfection, this is about building a foundation that's safe, sustainable, and beneficial for you long term. So let's go ahead and jump in. So, the first type of exercise that we're going to talk about is aerobic exercise, or more commonly referred to as cardio. Aerobic exercise involves rhythmic movement using our large muscle groups that increases your heart rate and oxygen use for an extended period of time. So this is the type of exercise where you start to feel your breathing really increase, your heart rate gets really fast, and your heart's working a lot harder. So walking and running are the most well-known forms of cardio, but cardio can look very different depending on your preferences and your abilities. Cycling, swimming, stair climbing, basketball, boxing, or even using machines like treadmills and ellipticals are all types of cardio. Cardio is called cardio for a reason. It directly improves the way your heart and blood vessels function. Aerobic exercise is going to increase that cardiac output, meaning that your heart becomes more efficient at pumping blood throughout the body. It also is going to improve circulation and reduce overall workload on the heart when it's at rest. Beyond the physical benefits, cardio has a lot of strong ties to mental health as well. It can improve your mood, reduce stress, and support overall well being. And since the heart is a muscle, like Rachel said, just like any other muscle in the body, it needs to be trained. Aerobic exercise is one of the best tools that we have to do that. And cardio is incredibly beneficial, but it's also not the only form of exercise that's going to support our heart health. The second type of exercise that plays a major role in heart health is going to be resistance training, which is also known as strength training or weightlifting. Resistance training is designed to increase strength by making your muscles work against some type of force of resistance. So that can be body weight, free weights, or bands. Some common examples include exercises like squats, push ups, lunges, and planks. These movements are going to challenge the muscles and require the heart to support that effort by delivering oxygen and nutrients throughout your body. Resistance training has many benefits that go beyond building muscle. It improves cardiac function, supports everyday movement, activity levels, going to strengthen your joints, and improve your blood vessel health. Over time, this leads to better efficiency in both movement and heart performance. One important thing to clear up is the common misconception that resistance training is only for bodybuilders or people trying to get bulky, right? Resistance training can and should look different for different people. A great starting point is simply mastering body weight exercises. And then from there, resistance can be added as needed. You know, you can use dumbbells, machines, bands, or even do functional movements like sit to stand exercises. It's also important to understand the difference between sets and repetitions here. So, a set is a group of repetitions performed consecutively. For example, 3 sets of 10 push ups means you're going to do 10 repetitions, so that's single movement, followed by a brief rest, and then 10 more push ups, brief rest, and then 10 more. Resistance training doesn't have to be intimidating for you. It's adaptable, it's scalable, and can be incredibly effective when used safely. The third type of exercise that works along both cardio and resistance training is going to be flexibility. Flexibility exercises focus on stretching the muscles and improving joint range of motion. This area of exercise is often overlooked, but it plays a critical role in how well we move and how we perform other types of exercise like resistance training, like your aerobic exercise. Adequate flexibility can reduce your joint stiffness, lower injury risk, improve circulation, and even enhance exercise performance. There are two main types of stretching, which are static and dynamic stretching. Static stretching involves holding a stretch at its farthest comfortable point for a period of time. So, a good example of this would be reaching out to touch your toes and holding that stretch for, let's say, 10 seconds. Dynamic stretching involves moving joints through full range of motion in a controlled way, and this is going to be things like leg swings, arm circles, or high knees. Both types of stretching have a place in workouts. Dynamic stretching is often helpful before workouts to prepare the body for movement, get that heart rate up, while static stretching can be really beneficial after your exercise or maybe on those recovery days. Yoga is another really popular and effective way to improve flexibility while also supporting balance and relaxation. Flexibility helps everything else work better. So when our muscles and our joints move the way that they're designed to, exercise is going to feel safer, easier, and more enjoyable for you. Before we go any further, it's important to take a step back and talk about recovery because recovery is not optional when it comes to exercise, it's essential. Recovery is the process of resting and allowing the body and muscles to repair after exercise. So when we work out, we're creating small amounts of stress and micro damage in the muscles and in our cardiovascular system. So recovery is going to be when the body adapts to that stress and comes back stronger and more efficient. Without proper recovery, the benefits of exercise don't fully take place. Instead of improving, we may feel consistently fatigued, sore, or even maybe see a decrease in our exercise performance. So there's going to be two main types of recovery that support heart health and physical performance, and they're active recovery and passive recovery. Active recovery involves light movement, while passive recovery involves our true rest. In the next couple of slides, we'll break down both types, explain what they look like, and talk about how you can incorporate them into your routine in a way that supports both your heart and your overall health. So let's break it down a little further, starting with that active recovery. Active recovery means engaging in low intensity movement rather than complete rest. So the goal here is not to break a sweat or push your performance to the limits, but to keep the body moving gently. So some examples of active recovery include things like light walking, maybe some easy cycling, swimming, stretching, or some light yoga. These activities are going to help promote blood flow without placing additional stress on the body. One of the key benefits of active recovery is improved circulation, which helps deliver oxygen and nutrients to the muscles that are repairing from the previous workouts. It also supports a strong aerobic foundation and can improve heart rate variability, which is a marker of how well your body adapts to stress. Think of active recovery as a way to help your body feel better, not more tired. If you finish feeling refreshed rather than drained, you're doing it right. So passive recovery is that other side of the recovery coin, and this is where rest truly becomes non-negotiable. So first and most importantly is sleep. So getting those 7 to 9 hours of sleep, especially after intense exercise days, is going to allow your body to spend more time on muscle repair and tissue rebuilding. Sleep is when your body does most of its physical recovery work. So another important part of passive recovery is also going to be taking days off from exercise. Rest days do not mean failure or laziness, they're essential for long-term progress. So really avoid stacking intense workouts on back-to-back days, especially when you're first getting used to working out and getting started. Lastly, hydration and nutrition play a huge role as well. Drinking water after workouts helps replace lost fluids, and then pairing some carbohydrates with protein after exercise is going to support muscle repair and also replenish energy stores. Recovery doesn't stop when the workout ends, it's going to continue with how you rest and refuel. So when recovery is consistently ignored, the body eventually will push back on you. This can lead to something called overtraining syndrome or OCS. This occurs when we exercise excessively without allowing enough time for recovery, and it's going to affect both the body and the mind. Some signs include decreased performance, you have a higher injury risk, and feeling like workouts are getting a lot harder than easier. So you might also notice some sleep disruptions, an elevated resting heart rate, or prolonged soreness. From a heart health standpoint, poor recovery can delay proper cardiac recovery between exercise sessions, which means the heart never fully resets before getting stressed again. So progress doesn't come from pushing harder every day. It comes from the balance between exercise and recovery. If recovery is missing, progress will stall. So this slide here is going to give us some helpful guidelines so that we can understand how much exercise is enough without maybe overdoing it. So for aerobic exercise, adults should probably aim for about 150 to 300 minutes of moderate intensity activity. This is something like a brisk walk, or 75 to 150 minutes of vigorous activity, which is more like running, and just making sure that we're spreading this throughout the week as well. It's especially important for individuals with heart conditions to consult with a healthcare provider before increasing intensity. High intensity exercise isn't always appropriate and can even be dangerous without proper guidance. For resistance training, adults should aim for about 2 to 3 non consecutive days per week, and this might be about 2 to 4 sets per muscle group, and make sure that we're focused on about 8 to 12 repetitions there. Lastly, flexibility training should happen about 2 to 3 days per week as well. So making sure that we're stretching to mild tension, not pain. Stretching should feel relieving, not stressful. So once again, these are guidelines, they are not rules. They're meant to give us structure and safety as you continue to build consistency in your exercise journey. So I do want to leave you with some practical tips for structuring your workouts in a sustainable way. So the first, one of the most important things is setting your SMART goals. So you want to make sure that you have goals that are specific, measurable, and realistic. So those small little wins can build momentum, and then you could start making harder goals. Second, really consider your accessibility to workout equipment, whatever's available to you. You want to make sure you choose workouts and locations that fit to your life. The best workout is always going to be one that you'll actually do. Third, build recovery into your workout plan, not as an afterthought. Rest days and lighter sessions are part of the program. Fourth, plan workouts around your schedule, not someone else's. Consistency is going to matter way more than perfection here. Fifth, remember that it's okay and encouraged to enjoy your exercise. Movement doesn't have to be a punishment. And lastly, have patience with yourself. Progress comes over time and every step counts. I also want to finish today by clearing up some very common exercise myths because these beliefs often create kind of that fear, guilt, or unrealistic expectations around movement. So the first myth I'm going to talk about is the no pain, no gain. Pain is not a requirement for progress. Movement should obviously feel challenging at times, but pain is your body's warning system. Exercising through pain increases the risk of injury and long-term setbacks. Sustainable exercise is about listening to your body, not fighting against it. Another common myth is the no days off. So, like I said before, rest days are not breaks from progress, they are part of the progress. Without rest, your muscles will not fully repair, your nervous system's going to stay overstressed, and your heart's not going to fully recover. So, making sure that we take days off to make us stronger, not weaker. A third myth is that long hours in the gym automatically lead to better results. In reality, consistency and quality matter far more than duration. A well structured 30-minute workout done consistently is way more beneficial than sporadic, all out sessions that are going to lead to burnout. Many people also believe that lifting weights is unsafe for older adults. In truth, resistance training is one of the most beneficial forms of exercise as we age. When done properly, strength training improves bone density, balance, joint health, and daily function, which is going to help people stay independent longer. Another myth is the belief that you must follow the perfect program. The best program doesn't exist, and it's not the most complex or intense. It's one that fits your lifestyle and can be maintained long term. Exercise should always adapt to your life, not the other way around. Finally, there's the myth that exercise should always feel motivating. Motivation is going to naturally come and go. What matters most is building consistent habits and routines. Even on days when your motivation is going to feel low, consistency is always going to win. If there's one takeaway we can have here is that exercise can be adapted for you. It's not a one size fits all thing. So I'm going to hand this back to Rachel and
Wonderful.
she's going to close us out.
Wonderful. Thank you so much, Noah. I really appreciate you kind of busting some of those myths, right? Because it is so easy to get caught up in the
Right.
things that we hear and the things
Mm-hmm.
that we see, and thinking, hey, this is the way that it has to be. But it is a good reminder that, exercise is not a one size fits all. We really got to do what works for us.
Correct.
So thank you, Noah. I appreciate all of that information. And again, I hope that you guys gained a lot from this presentation and learned how important it is to take care of you, take care of your heart by moving your body. So if there were any questions today that were not answered via the chat, you are more than welcome to email either Noah or myself. But thank you again for joining us this afternoon. I encourage you guys to join us next month. But have a great afternoon. Thanks again. Bye bye.